And unknown to them is that the health insurance that they buy has got certain limits or limitation around the amount of cover that they have when they are diagnosed with certain conditions. So they look at global cover rather than the sub-limits. And they only discover at the point of claim that they can only be covered up to a certain level. While we all know that some of these critical conditions are very expensive. And the biggest challenge that we've seen our customers go through is just running out of cash when they are sick. So they are not only worrying about their therapy, they're also worried about the financial status. Key differentiator here is that the amount of lump sum is provided on diagnosis. And the patient can then use the money to seek treatment from a facility or provider of their own choice. And that's really fundamental. So it's not about refunding the medical bills that have been incurred, but providing them with lump sum.
Indeed, a step in the right direction towards solving the critical diseases. Let's talk matters still insurance. Well, investment management firm ICA Lion Asset Management released its East Africa Private Sector Credit Report. The focus being on private sector credit share, growth, penetration and household debt. It was noted that in Kenya, not all sectors have felt the credit crunch equally since the introduction of the rate cap in 2016. There's opportunity to provide credit access in various sectors and improve credit penetration levels in the region.
In terms of Kenya, what we established was private households actually have the highest private sector credit share, highest share of private sector credit in the country, followed by the trade sector, and then manufacturing and real estate respectively. Just a note on private credit to private households, the SACCOs and microfinance institutions have now caught up with the banks, and out of the approximately 800 billion shillings in loans issued to private households, the SACCOs and microfinance institutions are now contributing half of all private sector, of all loans issued to private households in Kenya. So the SACCOs and microfinance institutions have caught up with the banks. Uganda is slightly different from Kenya and Tanzania in the sense that there is a good, decent double-digit contribution of private sector credit to the agriculture sector. You can see agriculture sector commands 13% of private sector credit in Uganda. And also the building and construction sector, which has very limited share in Kenya and Tanzania, approximately 5% of private sector credit. But in Uganda, you see the building and construction sector commands almost 15% and more of private sector credit.